I think there are a couple of advantages for the patient and there are advantages for the user. For the patient, I think it's the rapidity of the treatment. So you're talking of a treatment time around about 5 seconds. So during an average consultation time in podiatry, we would normally allot 20 to 30 minutes to spend time with the patient. And the fact that you know that the treatment time is going to be very short, you can spend a lot of time talking to the patient and explaining to them about the nature of warts, what to expect with the treatment, and the aftercare required, if any. And so, in that respect, it's quite a time economical treatment for the practitioner and also for the patient. I think the other advantage is that when you compare it to, say, something like cryotherapy, now cryotherapy is used quite widely and has been used for many years. As a treatment, when you put liquid nitrogen on someone's foot, it will spread. It's very unpredictable as to what will happen, where the ice will spread, and it will raise a blister quite often in many patients. The beauty of microwave is it travels in straight lines, so using the probe, when you apply it to the skin, it stays exactly where it's put. And you know that the area of the microwave exposure is exactly to the same size as the tip. And because of the device and the nature of microwaves, it's quite predictable as to what sort of depth. So when you're treating a patient, you know exactly how much of a dosage you're giving and what the likely outcome is going to be. There's no unpredictability whether the patient will blister, whether they won't blister. It's very uniform. And I think if you compare it to a laser, for example, one of the key parts of the function of microwaves is that it doesn't produce any smoke or plume or steam. So often as a practitioner with things like electrosurgery or using a high-powered laser, you'd be treating a wart and you need an expensive air extraction system to remove the smoke that comes off the treatment area. And that's often distressing for the patient, but it's also potentially a house risk when you inhale the smoke. But with microwave, you don't get any of that, which I think is a real advantage.